Hello, today I'm going to be talking about obsessive compulsive disorder. Obsessive compulsive disorder is a mental disorder where a person may feel unwanted thoughts or may feel obligated to perform certain behaviors to subside those thoughts. Obsessive compulsive disorder is also known as OCD. OCD can affect 2 to 3% of people within their lifetime, and it's more commonly seen within females. OCD can affect a person's quality of life greatly, and it is often seen going underdiagnosed and undertreated because of certain stigmas or ashamedness feelings towards OCD. According to Singh et al. 2023, OCD is characterized by two different characteristics: obsessions and compulsions. Obsessions are uncontrolled yet persistent thoughts, such as doubts or needing order and symmetry, and compulsions are repeated behaviors that a person feels they must complete. These compulsions could be counting or constantly checking to make sure the door is locked or the light is turned off, things like that. These compulsions will only provide a temporary relief for a person with OCD until an obsession comes back in. OCD can be obsessions, compulsions, or both. A person doesn't necessarily have to have both of them. They could have just obsessions or just compulsions. These compulsions are often time-consuming, and it has a big impact on how a person will live their life. OCD is often seen in comorbidity with depression, anxiety, schizophrenia, and ADHD. A person with OCD will know that their thoughts and actions are irrational. Because of this, they'll try to subside or suppress their thoughts, and this will result in a person going untreated or underdiagnosed. Some causes of OCD can stem from biological, genetic, or even environmental causes. A few biological causes are the differences in brain structures and functions. A person with OCD will have differences in the areas specifically of the brain that control decision making and impulse control. Genetically, a person is more likely to have OCD if their immediate family member has OCD, like a parent or a sibling. There are also genes that affect neurotransmitters like serotonin, dopamine, and glutamine, and these will have an impact on a person's OCD. Environmental factors that can affect OCD is trauma, stress, or certain learned behaviors. This can often worsen OCD or even just trigger it, but it does have an effect on a person with OCD. OCD is a term that tends to be used sort of flippantly within society. A person may claim they have OCD because they like to color coordinate stuff, but as we can see, OCD is a real disorder that has a significant impact on a person's life. So, what qualifies someone to be diagnosed with OCD? According to the DSM-5 criteria, a person must have obsessions, compulsions, or both that are time-consuming or that cause a significant impairment on a person's life. These obsessions and compulsions cannot be from substances or other mental conditions. It has to be individual and stand on its own. An evaluation of a person's life is necessary for this diagnosis to come to fruition. This can happen through questionnaires, interviews, or even just observation. Once a person is diagnosed, there are a few treatment options that they can go through to help their OCD. One of the more common and as seen as a really effective option is exposure and response prevention therapy. This is essentially exposing someone to their fears and trying to resist the compulsions. A medication that is seen to be taken by people with OCD is selective serotonin reuptake inhibitor. This can affect the brain chemistry of someone with OCD and help them to control their OCD. There are some people that don't react to either of these treatments. This is where deep brain stimulation can come in. This is, however, a very invasive treatment where electrodes are inputted into certain brain areas. However, this is really only used in severe cases, and many people do see significant improvement from the exposure response prevention therapy and from the selective serotonin reuptake inhibitor medication. People often have real-life implications that really affect their everyday life. This can interfere with school, work, and certain relationships. A person with OCD may have to perform a lot of rituals before they can even complete any tasks, like doing homework or simply things they have to do around their house. According to Guazzini et al. 2022, people with OCD gave social media more importance than others who didn't have OCD. This led to a higher likelihood that a person with OCD would become addicted to social media. This social media addiction can really draw a person's attention away from the daily tasks they have to do. They will focus in a lot on their social media apps and their phone and will probably get lost within it, unable to perform their tasks that they need to complete within the day. This will make it difficult for them to maintain routines, and it's hard for them to live a proper, fulfilling life. All these things can lead a person to OCD feeling isolated or ashamed of their condition, which can contribute to the reason why people go undertreated. They don't want to admit that they have any sort of disorder, and don't realize that if they do receive treatment, their life will be significantly improved. In conclusion, OCD is complex, but it is a treatable mental disorder. This involves an individual having obsessions or compulsions or both, and these obsessions and compulsions have a large impact on their daily life, making it difficult for them to complete simple daily tasks. OCD is a serious condition, and this shouldn't be taken lightly, and it shouldn't be shamed or suppressed. It should be supported and helped so people can get the treatment they deserve.